Welcome back to the Nursing Code Lab. If you haven't watched the first video in this series called The #1 Mistake Repeat NCLEX Test Takers Make and What to Do Instead, hit the pause button right now and go check it out. It lays the foundation for everything we are building in this strategy series. And today we are taking the next step with the Traffic Triage Map, or TTM, which is a strategy I created specifically for repeat test takers, nursing students, and internationally educated nurses. In this video, I'll show you how to identify red zone answers, the ones that signal urgency, instability, or danger. Even if you're unsure about the subject, learning to spot the red zone helps you to make safer, more confident decisions on exam day. So by the end of this video, you will be able to define what qualifies as a red zone answer on the NCLEX, be able to identify key red zone symptoms and urgency clues, be able to apply the red zone strategy to select the correct answer in NCLEX style questions, and avoid common mistakes that lead to overlooking urgent patient needs. So what is the red zone? If a patient is experiencing issues with airway, breathing, or circulation, shows new or worsening symptoms, has severe bleeding, critically abnormal lab values, or has been exposed to toxic medication, these are all signs of a red zone situation. Red zone answers point to patients who are unstable, deteriorating, or in a life-threatening condition. They require immediate nursing action from you, and they are essentially shouting, "Save a life now." All right, let's look at some of the red zone clues to watch out for in a question and the answers that are presented to you. First, we want to look for prioritization strategic words such as essential, priority, first, best, most, initial, early or late, immediate. We also want to look for any red zones that are related to vital signs that suggest respiratory distress or failure, poor perfusion, or sepsis infection, okay, such as hypoxemia, bradycardia or tachycardia, hypotension, bradypnea, tachypnea, or even hyperthermia. Then we also want to look for keywords that suggest danger, such as sudden, new onset, severe or unrelieved, confused, restless, lethargic, bleeding, stridor, shortness of breath, post-op, unexpected symptoms, emergency or urgency situations. There are also some conditions that are always considered red zones, such as chest pain, stridor, airway compromise, sepsis, stroke, hemorrhage or hypovolemic shock, an unstable postoperative patient, a patient with low WBC or low platelets or hemoglobin with symptoms, a patient who is confused, or an emergency or urgent situation. And there are also RN-only tasks that we need to consider as red zone for delegation questions if the action involves assessment of an unstable patient, initial teaching, a new admission, or evaluating a new or worsening condition. If it's red in regards to the delegation task, the RN must take action now. The key is to train your brain to recognize patterns that scream, "Act now," because the client could die, they could deteriorate or decline, or it could be an RN-only situation. All right, so let's look at this sample question. Which client should the nurse see first? Is it the client who is having chest pain and shortness of breath? Is it B, the client who is having nausea? C, the client who is asking for a bedpan? So here we have a prioritization question because it is asking who should we see first. We have a patient who has chest pain and shortness of breath. We have one that has nausea, And then we have another patient who is asking for the bedpan. So let's comment on these. So if I said here that chest pain, shortness of breath, we would say that this is a high risk patient, right? The nausea would be one that we would consider to monitor, right? And asking for the bedpan, yes, it's important, but we need to deal with the other two even before we deal with the patient who is asking for the bedpan. Okay, so I would say if we could delegate this particular task, we can do so. If not, then this patient would be seen after we have dealt with the patient who is having chest pain and nausea. Okay. So because this is a prioritization question, I am looking for a question that is in the red zone. So automatically, I'm going to cross off C because this is a delegation or delay task. So now I have to decide between chest pain and nausea, which one would be my red zone answer, right? So with nausea, I'm going to say we said it's a monitor, so it's not a red zone. But we do have a patient who has chest pain and shortness of breath. And if we don't deal with it right away, this patient's going to get worse. Okay. And we need to save this patient's life, right? So I would say that B, we can actually cross off for now. And our only answer here that's left is A, which would be a red zone. Okay. And would fit with what is being asked of us in the question, right? So it says, which client should the nurse see first? I should see the client who has chest pain and shortness of breath first, okay? So the correct answer here would be A. So let's take a look at a second question here. So which task can the RN safely delegate to an unlicensed assistive personnel? Is it A, assessing chest pain, B, bathing a stable elderly client, C, teaching insulin injection? So assessing chest pain. So number one, the key clue here is assessing. So we know that if there's any task or action that requires assessing, this is a RN only task, okay? B is bathing a stable elderly client. So this is something that we can delegate to a UAP. It does not necessarily need to be done by an RN only, right? Now teaching, right? Teaching insulin injection, well, it involves teaching. So we cannot delegate this to a UAP. This has to be an RN only task. So based upon that, I'm going to identify my red zones, right? So my red zones is going to be A, because that's an RN only task, as well as C, which is an RN only task. So I can actually cross off C and cross off A because the question is asking which task can the RN safely delegate. And so the only task that's available or that's left is B, which is bathing a stable elderly client. Okay, so it's going to be the correct answer here will be B. All right, let's do another question. So, which of the following findings require priority action? Select all that applies. Is it A, WBC of 18,000, C, a SpO2 of 88%, C, anxiety about surgery? So when we look at this question here, we will have more than one correct answer, right? We never have one answer that is correct. You will have two or more answers that are correct, okay? So when we look at A, which is WBC of 18,000, this is high, right? So we would want to keep this patient on our radar in terms of monitoring this patient, okay? And maybe following up to see Do they have any other clinical indications that would fit with a WBC of being 18,000? But they would require a priority action in regards to that. So we would say that this is concerning and could escalate to a red. Okay. An SpO2 of 88%. This is, of course, concerning because our patient is hypoxic. And so and it's respiratory. So we would want to act on this immediately. So this is urgent. So with option C, the anxiety about surgery. So this is important to be dealt with at some point, but this is one that we could probably delay, or the patient just needs reassurance. But the patient is, for the most part, safe at this point, right? So it wouldn't necessarily be a priority action in order to handle or manage the anxiety about surgery at this point, okay? So I'm actually going to cross off C, okay? And we're going to keep A and B because I've identified A and B to be my red zones for now, okay? All right, so let's look at some more red zone NCLEX style questions. So the newborn nursery nurse is performing an admission assessment on a newborn with a diagnosis of cephalohematoma. Which intervention would the nurse implement to assess for the primary symptoms associated with a subdural hematoma? Is it A, to monitor the urine for blood? Is it B, to monitor the urine output pattern? Is it C, to test for contractures of the extremities? Is it D, to test for equality of extremity reflexes? So the question is not who do I see first, but which action helps me to detect danger. So I have my assess for primary symptoms that's associated with a subdural hematoma, which is a serious neurological condition. Okay, so, and the keyword here is assess. So let's break it down using the TTM. So step one is to understand the STEM, which is the question, okay? And in the STEM, it is asking me what should I do to assess for complications, right? Specifically related to subdural hematoma, which is a bleed on the brain, right? So it's not a prioritization question, but the correct answer should reveal red thinking because we're hunting for signs of deterioration. So step two is we now need to label the answer choices. So let's look at each answer and filter it through the TTM lenses. So the first one is A, which it says monitor the urine for blood. So the first thing that's standing out to me here is number one, it's saying to monitor, and I'm looking for something that indicates that I need to assess. So monitor the urine for blood. So this is going to be incorrect. Okay, there's no connection to subdural hematoma here. Bleeding in the urine is usually unrelated. So this here to me is a stable task. There's no urgency and no relevance. Okay. B also has monitor here. Okay. And when we think about our multiple choice questions, when you have questions that are very similar, they most likely will both be incorrect. Okay, so but here we have monitor. So again, I'm not looking for anything regarding monitoring, I'm looking for more assessments. And, even though urinary output patterns can be an issue for a patient who does have a neurological injury or traumatic brain injury, in this situation for the NCLEX, we go with the most immediate primary clue, right? And so when we talk about urinary output and neurological conditions, that is more in the advanced stages. And yes, we could be looking for specifically SIADH, okay? But again, for the NCLEX, it's just, we're going with the most immediate primary clue. Plus, urine output pattern does not always equal early or primary indicators of subdural hematoma. It is too indirect of an answer and not the most clinically urgent or relevant first step. right? So again, it is not assessing for danger, and this is not urgent. So I crossed off B. Now, if we look at C and D, so both of these say test, which is part of your assessment, right? So it could be either C or D. So C, test for contractures of the extremities, okay? Contractures could reflect neurotone in the long term, right? But contractures takes time to develop. So it is not useful for early or primary signs of a subdural bleed, right? Or hematoma. And it has mild clinical relevance, but it's not the best way to actually detect any sort of acute changes, which is what we're looking for. So I'm going to cross this off. So then my only answer choice left is D, test for equality of extremity reflexes, which if we do have any unequal reflexes in a newborn, this might mean that the newborn has an increase in their intracranial pressure, or maybe there might be bleeding or some sort of neural compromise. So this is your early red flag sign here, okay? And this would indicate that the hematoma is progressing into a dangerous neurological situation if there is any inequality in the reflexes. All right? So here the correct answer is D. Okay, so let's look at another question. So the nurse creates a post-operative plan of care for a client undergoing an arthroscopy. The nurse would include which priority action in the plan. So we're looking at a plan, okay? You are being asked to decide what matters most right now for safe and early detection. So our answer choices are A, monitor intake and output, B, assess the tissue of the surgical site, C, monitor the area for numbness or tingling, D, assess the complete blood cell count results. So A, monitor intake and output. While always important postoperatively, right, monitoring intake and output, this is a routine and stable, non-urgent monitoring task, right? So there's no context that suggests that there is a fluid imbalance or renal concern here. So I'm going to cross this off here, okay? Now, B is where we're going to assess the tissue at the surgical site. So this is important for healing and wound care, but again, it's very general. It's not specific to early post-arthroscopy complications, which is what we're looking for. So I'm going to cross this off as well. Monitor for numbness and tingling, right? So this suggests a risk of a neurovascular compromise, right? Your numbness and tingling. So this is one of the most crucial early post-op complication. And it's one that is related as well to arthroscopic or orthopedic procedures. And so it's an early sign of loss of circulation or some sort of nerve dysfunction. Numbness and tingling can indicate nerve compression, it can indicate circulatory impairment, or even compartment syndrome. So we need to monitor for this and not delay, okay, in doing this. So I'm going to circle, well, keep that one there for now. And then D, we have assess the complete blood cell counts. And so here, yes, it's helpful to know what the blood cell count is post-operatively, but it's not urgent unless you're actually seeing visible signs of bleeding. Then we would want to, put this up a little bit higher on the urgency list. But for now, we don't have any information that there's any active signs of bleeding, and so it is not urgent. Okay? So I'm going to cross this off here. So then if I go back now to my question, it says here the nurse creates a postoperative care plan. the nurse would indicate which priority action in the plan. So my priority action in the plan is that I need to monitor the area for numbness or tingling. Okay. So in this question here, the correct answer is C, which is a red zone. Okay. So sometimes repeat test takers might miss the red answer because they would focus too much on pain or patient requests, or they may pick what sounds familiar to them, or they might forget that respiratory symptoms always come first when sudden, severe, or unexpected symptoms show up. So it's very important for you to train yourself to scan for the red first. Always scan for what is red first before comparing the details. And then at that point, you can determine if the red zone answer choice actually matches your question, right? So by you being able to identify questions and answer choices that are in the red zone, this gives you so much power. It allows you to take control of the question because you have trained your brain to see red. And you don't need to be perfect at content recall. You just need to be able to recognize what matters most. And you need to be able to do that in a way where you can identify what needs to come first, what is priority, what needs to be done immediately, right? So by you color coding the answer choices and then matching it with the type of question that is being asked, that is giving you so much decision power. So I've created something really cool for you guys, and it's a free resource to help you remember and to work through how to identify red zone questions and answer choices. So it's called the Red Zone Checklist, Act Now, Save a Life. And it's a 5-page checklist document that you can download. The link will be in my description box so that you can click on it and get immediate access to it. Okay, to download it. It's a great resource. I encourage you all to go there and download it, and it's for free. And so the next video of the series is going to be video number 3. And this is where we're going to talk more about how to identify answer choices and even questions that fit more within the yellow zone. So the monitoring zone, the watch closely zone. You know, if we don't do something, this patient could possibly get worse. So within that zone, I'm going to help train your brain to see those specific answer choices and questions. Okay, and that will be in video number 3. So if you liked what you learned today, please don't forget to subscribe or like. And if you subscribe, you'll be notified when I download the video number 3 to the traffic triage map series. All right, then, until next time.